Why do my teeth feel loose? Teeth can get loose for a number of reasons. Gum disease. This is the most common cause of loose teeth. In adults, you can notice symptoms like bleeding gums, swollen gums, and gum recession. Trauma. Injuries to the mouth or face, such as form of spots or accident, can cause teeth to lose. Teeth grinding. Clenching or grinding your teeth can cause teeth to lose over time. Pregnancy. Hormonal changes during pregnancy can cause pregnancy-induced gingivitis, which can lead to loose teeth. Osteoporosis, a disease that causes bones to weaken and decompose, which can lead to loose teeth. Menopause, as women age, estrogen and progesterone level decrease, which can lead to bone loss in jaw and loose teeth. Dry mouth can cause the risk of gum disease. Other risk factors for tooth loss include poor oral hygiene, smoking and tobacco use, and some medications. A dental professional may be able to save a loose dental teeth by splinting, remove it, or replace it with an implant or bridge.